We did it. 2 days, the first Telebehavioral Health Summit. I don't know about you, but I had a big time. And there's so many thank yous I want to give out real quickly. I know we have to hand it off, so I'll be quick. First off, huge thanks to all of you who attended, took time out of your busy schedule. Our sincere hope is we were able to deliver what you wanted. We heard from you that you wanted this summit, you wanted these topics, and we wanted to keep it really practical for frontline providers. And my sincere hope is that over the last 2 days, we've been able to give you practical information you can take into the field and do a better job caring for those that you work so hard for. The second group I want to thank is obviously our speakers. Wow, they far exceeded my expectations. They all were, every presentation I heard today was, for me, really fascinating, and heard a lot of new information, and their ability to take complex topics and bring them down for a simple public school product like me, even I could understand. Just great. The third big thanks goes out to the amazing professional staff that put this on. I've never had an opportunity to work with such professionals. And boy, the success of this summit is really, I lay that at their feet. They don't get enough credit. Finally, some big thanks to our friends at NRTRC, Northwest Telehealth, and of course, the Washington State Healthcare Authority for funding this. This has been just fantastic. Couldn't have done it without all of them. So thank you. Next slide, please. So you've heard us talk about the Telebehavioral Health Series. I just want to tell you a little bit about it and where you can access it. This is what we referenced early on and talks upon. It's a whole series of progressive lectures. You don't have to do the 101 to do the tool. We just got lazy and couldn't come up with different names. So, but there's core information in the 101. It continues to build. And at one point, we do make a pivot to how do you start, now that you've learned this information, how do you start using it in the field? And it's free, it's self-paced, and I would encourage you to go there. I'm going to introduce our final speakers here for the day. Introduced Dr. Mclaughlin yesterday, but she is the director of the BHI, licensed clinical psychologist, having dedicated her career to ensuring equitable access and services for all people. Also want to introduce Ms. McKee, who's been a fabulous support for me. Thank you. She has a master's degree in mental health counseling and is a licensed substance use disorder professional, having worked in the field for almost 20 years, and is the program director for training, workforce, and policy innovation pillar of the BHI. This center within BHI advances projects relating to strengthening Washington State's behavioral health workforce, increasing equitable access to quality training for all providers in Washington, improving behavioral health policy at the regional and state level. So I'm going to exit stage left. It's been a complete honor and privilege to be part of this seminar, and I'll see you guys later.
Thank you so much, Dr. Felker. And I wish we were in the same room so we could give you a big round of applause, but maybe everybody could give him a big virtual round of applause. Maybe we don't have reaction buttons when we're in the Zoom webinar technology, but anyway, applause to you. You have done an incredible job emceeing this entire summit, and we thank you so much for your partnership and for everything that you brought to make these last 2 days happen. And hello again to many of you who I met yesterday morning, and for those who weren't able to join. Again, I'm Susan Mclaughlin. I'm the director of the Behavioral Health Institute at Harborview Medical Center. And if you're not familiar with the Behavioral Health Institute, we're a center of programs and a think tank that's bringing together the expertise at the medical center here at Harborview, as well as the University of Washington, focused on finding solutions to some of the problems facing our behavioral health systems today. And we do this through developing and launching and testing new clinical innovations right here on our campus with the clinical programs that we operate, building and training the workforce of the future, which you've heard a lot about over the last 2 days, and evaluating and conducting state-of-the-art research for new and effective treatments. Behavioral Health Institute also serves as a regional resource for the advancement of behavioral health outcomes and policy. And we're also working to support sustainable system change. You heard on day one and probably throughout the last 2 days about Washington State's Healthcare Authority. They approached the Behavioral Health Institute very early on in the pandemic to provide training to the thousands of community behavioral health providers across our state who, just like everybody else and all of you, had to learn an entirely new way of delivering care to individuals experiencing mental health and substance use disorders. Not an easy task, as you know, and I think what you've witnessed over the last couple of days is the culmination of that work. Brad was just talking about training series. We've reached over 10,000 clinicians and administrators across 45 states and put on this first ever summit, which it's just so amazing to bring so many smart people who are really passionate and dedicated to the task of figuring out how we venture into this new world of telebehavioral health. It's so important for access. It's so important given the workforce shortages we're experiencing, and it's so important for addressing issues of equity. And quite frankly, it's more and more how many people want to receive their care these days. So figuring out how to do it and how to do it well is extremely important in my mind. One of our 3 pillars of the Behavioral Health Institute, as I mentioned, is our Training, Workforce, and Policy Innovation Center. Our commitment at the BHI is to collaborate with community partners, and university partners to grow and strengthen Washington State's behavioral health workforce, to train the workforce of the future, and to increase equitable access to quality training for all providers in Washington. And this is an example of how we do that. The Healthcare Authority's generous support of the summit has allowed us to provide that to all of you for free. And we want to continue to do that. We want to continue to work and partner with folks. So if you're interested in learning more about us or have some ideas for partnerships, please reach out through our website, and we are happy to make connection and build relationships. We have some other really cool and innovative things going on in our training, workforce, and policy pillar, including reimagining behavioral health through race, equity, and social justice. We sponsor a conference every year for the past 3 years. We have been on this topic, and we are in the planning stages for our 4th one, which will happen this upcoming fall. So if you're interested in that, please see our website. We also do a call to action series in between the conferences to really try to bring those learnings into communities and create opportunities for actionable change. Some of the other things that we're working on are we've helped develop and launch a behavioral health apprenticeship program in partnership with our local SEIU 1199 training fund. And we currently have 3 cohorts of apprentices that are in training right now to become behavioral health technicians, peer counselors, and or substance use disorder professionals in our state, with more cohorts to come. So building that workforce of the future, thinking outside the box from traditional positions to how we use community and non-licensed positions to help support and spread the workforce. And we're really proud and excited about that work. And many other things that we're doing here at the Behavioral Health Institute. So it's been a fantastic 2 days. I would echo all of Dr. Felker's thanks, and I'm going to turn it over to Melody, who's going to thank even more people. And so I'll join in her in what she says as well. So Melody, turning it over to you.
Good afternoon, everyone. Thank you for having us. I'm happy to be here today to help close out this fantastic event. As mentioned, I'm Melody McKee, the director of the BHI's Training, Workforce, and Policy pillar. And, it's a complete honor to be and privilege to be a part of the portfolio of work that Susan described. Thank you so much, Susan, for highlighting the work that's happening in the pillar. I'm honored to be associated with the folks who are responsible for pulling off this amazing summit. I mean, wow, it's really been an incredible day, 2 days of rich content and outstanding subject matter expertise. I was able to attend most of the summit and found all of the content so incredibly relevant and timely, and I really appreciate all of our fantastic speakers, but mostly just really want to focus on the folks within my team and the team at the BHI and our great partners responsible for putting the summit on. I want to start with Dr. Felker. We at the BHI are so grateful for his wealth of knowledge and amazing connections. Brad brings expertise as a busy mental health clinician and has offered invaluable insight about what is important to mental health and behavioral health colleagues and how to best build a conference that meets their needs. Brad's consultation throughout building of our telebehavioral health curriculum has been nothing short of exceptional. Thank you so much, Dr. Felker. We really appreciate you. Next, I would like to thank Cara Tal. Cara is the Associate Director of the Training, Workforce, and Policy Pillar here at the BHI. While Cara has been instrumental in multiple projects spanning our pillar, she has been the leader of all things telehealth for us. I remember shortly after the start of work 3 years ago, becoming acutely aware that I had quite literally struck gold when it came to Cara. Cara has worked in the telehealth realm for over 20 years and brings a wealth of knowledge that has been instrumental in the success of every piece of our telebehavioral health work. Cara's spirit of collaboration and dedication to the work are so inspiring to me and to our team. It's important to note that while telehealth is not new, delivering community-based behavioral health care throughout a global pandemic was new. Thank you, Cara, for all you have done and continue to do for our communities. I would also like to thank Michelle Patient-Stahl, our engagement strategist, for developing and executing a stellar marketing plan in collaboration with NRTRC, and Topher Jerome, who I tease him frequently about having the curse of competence because he can do just most things. And but for this particular project, we're really grateful for his work on the website and on Whova, the platform that has hosted all of you today and yesterday. Also, thank you to NRTRC for your fantastic partnership. And finally, big thanks to the Washington State Healthcare Authority for providing the funding for the summit and allowing us to offer broad access at no cost. Thank you so much for that. I also want to acknowledge the Washington State Healthcare Authority for their thought leadership and their level of effort as we responded to the pandemic, as Susan mentioned, through our telehealth training and technical assistance effort. Thank you all for being here, and please feel free to reach out if you have any questions about the CMEs, CEUs, certificate, etc. And thank you again for participating.